Good day, I am Senior Clerk Joshua Grapa, and I will be demonstrating a video on how to perform wound suturing. First, introduce yourself and establish rapport with the patient. Examine the wound and explain the procedure to the patient. Assemble the following materials. You are going to need a syringe, an anesthetic such as your lidocaine, surgical scissors, needle holder, pick-up forceps without teeth, your suture, and your sterile gloves. Compute for the amount of lidocaine to be administered using the formula that is presented. If we have a 45 kilogram patient and we are going to use 2% lidocaine, then we should infuse 11.25 ml. First, aspirate your anesthetic from the bottle observing sterility. Remove the air from the syringe by gently pushing the plunger and flicking the syringe a few times. Inject the anesthetic with the bevel of the needle facing up. Then, check for the effect of the anesthetic by asking the patient if he or she can still feel any painful sensations. Use your pick-up forceps with one hand to hold the needle. Then position the needle at the tip of the needle holder. The needle should be held 2/3 midway of the needle. Introduce the needle approximately 1 cm from the edge of the incision or the wound, making sure that your wrist motion follows the arc of the needle. Perform an instrument knot or a square knot. Make sure that the knot is tight and that they lie on one side of the incision or the wound. Using your surgical scissors, cut the knot at 1 cm. Repeat the procedure several times until the wound or the incision is fully closed. Lastly, test for the strength and integrity of the sutures by using a curved Kelly. After performing the procedure, it's important to do the following. First, do appropriate aftercare by disinfecting the site again and placing sterile gauze and plaster over the wound to prevent exposure. Next, dispose used materials in their designated waste receptacles. And finally, educate the patient on proper wound care to prevent complications such as a surgical site infection. This has been Surgical Clerk Joshua Grapa. Thank you for listening to my demonstration.